Hello everyone. In this lesson, we will learn the method of bed bath together. As people age, THS can promote skin blood circulation. It can prevent the occurrence of pressure ulcer infections. It promotes physical relaxation. It increases opportunities for activity. However, some elderly PL can adjust according to the elderly's sleep characteristics. Other RTO adjust their sleep habits independently. At this time, we need to provide bed bath services for the elderly. The specific operation methods are as follows. 1. Assessment. Environmental assessment. The environment is clean. The temperature and humidity are appropriate. Ensure the room temperature is above 22 degrees Celsius. The elderly assessment includes overall assessment and local assessment. It mainly assesses the elderly's disease condition and consciousness state. Understand whether the elderly can cooperate with the operation. The local assessment evaluates the integrity of the elderly's skin. And let the elderly urinate as needed. Diagnosis. Judge whether the elderly have poor sleep or other conditions. Whether the elderly have poor sleep. The reasons: needs to stay in bed, cannot take a bath independently, and needs a bed bath. To keep the elderly clean and promote the elderly's blood circulation. Planning. According to the elderly's specific situation, plan to give the elderly a bed bath in half an hour. Implementation. First, prepare supplies. There are towels, bath towels, and bathing products. The basin contains warm water at 41 to 46 degrees Celsius. The caregiver prepares by keeping clothes neat and tidy. Wash hands thoroughly. Communicate with the elderly and explain the purpose and method of the operation. Let the elderly understand the key points of cooperation. Draw the curtains or use a screen to protect the elderly's privacy. Help the elderly cover with a bath towel. Unfold the quilt. Use the bath towel to cover the exposed parts. Conduct the bed bath. The method is to take off the clothes and pants. Place a large towel under the area to be wiped. Soak a small towel in warm water or ethanol. Wring it until it is semi-dry. Wrap it around the hand. Make it into a glove shape. Wipe in a centrifugal manner. For each part, after wiping, dry it with a large towel. Sequence 1. Wipe both upper limbs. Let the elderly take a supine position. Wipe in the F after the operation. Evaluate whether the elderly feel comfortable. Shoulders, lateral side of the upper arm above the shoulder. Back of the hand. Inner side of the upper arm to the palm of the hand. Armpit. Then wipe the lateral chest. Two, wipe the elderly's waist and back. Let the elderly take a lateral position. From under the neck to the shoulders, buttocks. Free, wipe both lower limbs. Let the elderly take a supine position. Wipe the sacrum, lateral side of the lower limb, and dorsum of the foot on the outer side. On the inner side, wipe from the groin to the inner side of the lower limb. During the operation, ask and observe the elderly's condition. Check for abnormal conditions such as chills and pale face. After drying, help the elderly put on clothes and pants. Provide corresponding psychological counseling, a comfortable lying position. After the operation is completed, tidy up the bed unit. Open the curtains or remove the screen. Tidy up the supplies. Wash hands and make records. After the operation, evaluate that the elderly feels good. There is no discomfort, and the environment is tidy. The supplies are placed reasonably. The supplies are handled correctly. The precautions for bed bath are: 1. During the bed bath, pay attention to observing the condition of the local skin and the elderly's reactions. 2. Contraindicated areas: anterior chest area, abdomen, back of the neck, and soles of the feet. 3. When wiping, use a light patting method. Avoid rubbing. 4. During the bed bath, pay attention to protecting the elderly's privacy. Avoid excessive exposure. Pay attention to keeping warm and ensuring safety. That's all for this lesson. Thank you all.